According to a 2019 article in the CNN library, 10.3 million Americans misused opioids in 2018. Now 9.9 million of which abused prescription medications, and 800,000 were heroin users. This is a problem that the US is facing, and I've personally been affected by it because my uncle passed away of an overdose at the age of 36. Now this might be a problem in places that you might not have seen it. For example, last year I had surgery and was given painkillers. I later found out that there were moms in my neighborhood asking for my leftover pain medications. By following Switzerland's drastic but effective treatment plan, we would see a great improvement in our opioid-related problems. Before I delve into the specifics of Swiss policy change, I will explain the problems both countries have faced, as well as the cause of our opioid crisis. To begin, I'd like to prove the evidence for the need to change US policy. In a 2018 Medscape article, David Dixon stated that fatal overdoses tripled from 1999 to 2016. And just between 2015 and 2016, they increased by 20%. This has led to a 2-year decrease in life expectancy. This is the greatest decrease since the 1960s when the flu was the cause. In a 2018 KFF article by Lindsay Dawson and Jennifer Cates, they write that an increase in injecting drugs, such as heroin, causes an increase in blood-borne infections, such as HIV. This is mostly due to the problem of needle sharing. Switzerland faced similar problems in the 90s. A 2018 article from the North Carolina Health News, Taylor Knopf stated that streets were littered with used needles. The heart of Zurich was deemed Needle Park. People were dying in front of parliament buildings and nice hotels. This was deemed the equivalent of someone dying on the White House lawn. Now that I've discussed the problem, I'll move on to explaining the causes. A CDC page last reviewed November 1st, 2019, explains how the rise in opioid abuse in the US came about in 3 ways. So the first wave started in the 1990s, where you can see there was an increase in prescription drugs, meaning that doctors were prescribing them more often and more leniently. In 2010, there was a rise in heroin overdoses. This also led to a rise in HIV. And in 2013, there was a greater production of synthetic opioids. This includes fentanyl, a drug that can be found in trace amounts in other drugs and substances, and people are overdosing on this drug without even realizing what they're taking. Finally, I propose a solution. The Swiss people and government made the risky decision to shift their efforts from prohibition to treatment. They did this with a 4-pillar plan. The pillars include harm reduction, treatment, prevention, and law enforcement. Law enforcement shifted gears from targeting the abusers to focusing on the distributors. And the main way that this 4-pillar plan was enacted is with these drug consumption rooms. As you can see here, they provided clean needles, medical staff that would overlook, and they provided dosages that you could not die from. One big thing that these consumption centers provided is also rehabilitation opportunities. The 2016 article by PRI and Stephanie Knoll states that almost 70% of heroin users in Switzerland are in substitution therapy. This is the greatest ratio in the world. A 2018 The Nation article by Cedric Governor describes how this solution resulted in no reappearance of open drug scenes. Also, drug-related crimes greatly decreased. Just between 1995 and 2015, there was a 12 times decrease in overdose deaths. The positive outcome proves that the best way to prevent use is to take control by regulating the market. In conclusion, I've provided information on the opioid crisis in the US, along with the causes, and I proved the effectiveness of the 4-pillar plan in Switzerland. Based on the evidence provided, I believe that a similar particular 4-pillar plan will do a great deal in decreasing opioid-related deaths and abuse. I understand that Switzerland has a smaller population than we do. This is why I say that we should start on a smaller scale, state or citywide, and then plan accordingly. Now, when voting, I want you to consider the treatment versus prohibition policies, and I would like you to consider those who are in favor of those policies. Now, I'd like to remind you that we are not only saving the lives of those who would have overdosed, but also the abusers. These are people who have families. They're not just someone on the street who's taking drugs. They love and are loved. I'd like to leave you with this quote from a man who came out on the other side of treatment with a new lease on life. I don't really have any memory of the worst times. It's like a hole. I have no idea how long I vegetated in that state. If it had continued, I'd be dead today.